been 35 years that I work with Dr. Balling day and night, week after week. David has become essential to this hospital. He's a pillar, he's an icon. It's hard to imagine that we are going to be able to manage a fever or a white count without David's presence, with his input. I'm experiencing a syndrome called retirement envy, to have David resting in the beaches of Wisconsin, and we are here laboring.
When I started my residency over here a little over 20 years ago, he was here and he has always been an icon for the whole Weiss community. And Weiss will certainly not be the same without him.
Dr. Balling, one of my favorite doctors here at Weiss. I will miss you and your wife. How often we saw each other outside of the office at wine tastings, which just tells you how much more fun it is to see you out of the hospital than in the hospital.
The only physician's handwriting who's better than mine is that of Dr. Balling.
There's very clear, intelligent, legible notes.
Block printing or whatever you might call it, but excellent.
What is this? Is this your handwriting? What kind of chicken scratch is this?
Dr. Balling, I've only been here for a year and a half. Anytime that we got a patient in the ICU, my first hope was that they had an infection beforehand so that I could read your notes.
Aren't you supposed to be in the ICU?
He knows his infectious diseases.
He's one of the best infectious disease doctors.
You know, I am the best.
The driest sense of humor that ever walked through the halls of Weiss Hospital.
He's just so funny.
Can we do this again?
David, it's been a pleasure knowing you, to miss your advice on my patients, your wisdom in our meetings, and most of all, I'm going to miss you as a friend, like a brother.
I plan on documenting in my notes for the next 12 months DC antibiotics if okay with Dr. Balling. You have always been extraordinarily thorough.
Immaculate.
Thorough.
I would definitely say thorough. Very thorough.
Are you sure? Did you look everywhere?
Yeah, I'm pretty sure.
Did you do a rectal?
No.
You've got to be thorough. You've got to be thorough.
I could show you love in a tidal wave of mystery. You'll still be standing next to me. You could be my luck. Even if we're 6 feet underground, I know that we'll be safe and sound. The reason I can be so thorough with all the patients is that I have all these clones to help me.
I know Dr. Balling for about 25 years.
Gosh, it's so long ago.
He was my teacher, my esteemed colleague, and a wonderful role model.
I could lift you up. I could show you what you want.
He's the superhero in controlling the infections.
Be my luck. Even if the sky is falling.
superintendents around here who are now your teachers who have been my residents, including Dr. Ali, Dr. Sabakan, Dr. Rose, Dr. Ilahi, Dr. Al-Kubaitari, Dr. Dudek, both Janusz and Marta, both Dudeks. I think they were all pretty good residents.
It's unbelievable that Dr. Balling is going to retire. We never thought it would happen. Now, it looks like the day has finally come. But it's been certainly proud not to only have him as my teacher, but also eventually as my colleague and my very good friend. This will never be the same.
Weiss will not be the same without you.
My wife and I are moving to a new home in Wisconsin, a little beach on the lake of our own. The house is on about 2 acres of land, and we're looking forward to having a nice garden, some vegetables and flowers.
We want to thank Dr. Balling for the decades of service in treating everything from athlete's foot to deep abscesses, and pity the mushrooms that try to invade his wife's 2-acre garden.
We wish you the best of luck in your retirement.
Bye, Dave. Oh, invite me up to Milwaukee there, but only when it's warm out, after you get your boat.
You're a great, wonderful clinician, and you will be sorely missed.
Hi, Dr. Balling. All the residents you've trained in the past will always know about infectious disease better because you were a part of their education.
I think a lot of the residents who will be here after this will miss that experience and that bedside demeanor that they would get from Dr. Balling. He taught me, and I'm sure I will take a lot of those things with me throughout my career. Thank you, Dr. Balling.
I think Fargood will still page you for student lectures.
Dave, I remember when I first met you when we were residents back at the VA hospital and we were young. Who'd have thought that we would have made it this far together and that you'd be the smartest one to leave first. All the best to you, and Peggy, I will surely miss you.